Generally, for extractions, definitely you want to, if you're treatment planning, any follow-up implant placements and all, it's a good idea to enhance the bone with a bone graft. Collagen plugs help with the healing, creating a good blood clot, reducing the bleeding. So definitely speak up on that and diagnose that and discuss that with the patient. Now, for the hygiene exam, 6 months perio chart needs to be done by the hygienist. Yeah, perio charting definitely, even if the patient is coming back for re-eval after an SRP or a perio maintenance, definitely we want to have a perio charting done and documented. And if there is bleeding or probing and other active disease, we have to talk about adjunct treatments to the patient, which involves doxycycline or even perio trays with hydrogen peroxide delivery in the deeper pockets as a non-surgical adjunct treatment to the SRPs, and follow that up every 3 months, and if needed, refer to Dr. Mehra, the periodontist, and she will talk to the patient if there's any need for any further surgical intervention. The periodontist really will only do surgery if the basic parameters are met, which is a good hygiene, and SRPs have been done, and at least 1 or 2 times followed up with non-surgical intervention. She would suggest surgical intervention at that time if needed. Then wanted to talk about Invisalign ClinChecks. How many of you are doing are looking for ortho malocclusions in your exams? Can I get a kind of a feedback on that? You can unmute yourself.
Yeah, I mean, I definitely check it.
Yeah, I always check it as well.
Yeah, that's standard for me.
Yeah, so definitely document, the malocclusion classification, gauge patient's interest, take some photographs. I think it really helps for the patient to actually see it. And we do have a simulation photograph in either the Invisalign app on the iPad for most offices. Ishan or Anish, do we have that for most offices? It's a quick simulation.
Every office has it. Yep.
Every office. So we just want to make sure that patients or people are aware of it in the office, the staff and the clinicians, the doctors. You can do a quick simulation and really does help. In the offices where we have iTero, you can do the same thing, and it gives a little bit more professional, simulated photograph. So, gauge patient's interest and then follow through with that. And,
Sorry,
as
Dr.
soon as-
Furry,
Yes.
but Anish, where are all of the associates at? I feel like everybody in here, I feel like we need more of the associates in here.
Yeah, I think this email went out late. I think he sent it out today in the morning, and I do not know whether people have.
I mean, these other associates need to hear all of this stuff. I mean,
Yeah,
realistically, we only have like 2 people who need to hear this in here.
right. I know.
Okay.
But we'll keep it short because not too many people. I think I talked to Sujal to send this out.
So I'll send this out to everyone after this.
Sorry?
I'm recording this call, so after you're done, I'll send it to everyone.
Okay.
Yeah.
Sounds good.
Okay. But I think we need to maybe do an advanced email so people are aware of it and they can plan for it to attend the meeting. Right now, we have only a couple of people here, but we'll go through with it. We'll keep it short. Invisalign ClinChecks. There is basically, let me talk. Basically, Josh is attending this Mollis Coaching PACE program, and he is one of the highest producing general dentists who does a very high volume of cases efficiently in Invisalign, and he has some clinical preferences, either in the global clinical preferences or specific to that malocclusion. And we have put those in the portal. All those have been have already been put in, and that will help um, treatment plan all our Invisalign cases very efficiently and without doing too many of refinement cases. And even the ClinChecks come out faster. You don't have to do it repeatedly, or you don't have to edit that or refine it in the initial ClinCheck approval. And then at the end of the case, we end up doing a lot of refinements. With these ClinCheck preferences, it should definitely help. So pay attention to those, go in there in the portal and kind of review all those general global clinical preferences and specific clinical preferences. He has done a deep dive into it, uh, and he's got lots of experience. I think he's one of the um, highest producing general practitioner who's doing ortho cases. So he definitely has a lot more insight into that than most people. So we can benefit from that. Use that knowledge base to refine your cases or approve your ClinChecks. As your cases come in, and the Invisalign portal will put those ClinCheck reviews for that particular doctor. You will have your name in front of your patient and which office. So I would appreciate if everybody gets to it in a very timely fashion, like the same day or the next day once the ClinCheck is posted, because these patients are scheduled for aligner deliveries in about 3 weeks or so. So if you don't get the ClinChecks done in a timely fashion, it gets delayed, and we have to reschedule the patient, which is not the best thing to do from a patient's point of view. So keep that in mind. Sujal is responsible, or I just want to make sure the doctors kind of keep that in mind and visit the portal regularly, particularly if they've started a new case, or they are doing a refinement case, because those ClinChecks get posted pretty fast as soon as they receive the records. A lot of times they have the records where they say that please redo it. So all you have to do is call their clinical team, and they will go through with that. And most of the time, you can overrule that, and they will proceed with the case. Otherwise, the case is on hold if you don't make that effort to call them. So please do that. Um, is everybody with me on this? Any questions?
Yeah, I have a question.
Sure.
So for Invisalign, is that the only brand that you do? Do you do ClearCorrect also, or is it just that strictly?
We are
one brand?
just we are just doing Invisalign currently.
Okay.
We have intentionally not gotten a second software for that, because I think it just creates confusion.
And then when I do see a case that's an easy Invisalign case, do I refer that to one certain practitioner, or and you guys have an orthodontist that's in house also for difficult cases?
Difficult cases. I have almost 20 years experience doing this, but there are cases where I know what not to do, right? So if
Yeah.
you have a case which is like a class 3 or really crossbite case or difficult case or intrusion case or expansion case, these are generally considered difficult for aligner protocol. Yeah, I'll be happy to look into it. You can send that case, or I can review the scan on that patient. And if you can get it done in a timely, efficient way, we do it. Otherwise, we refer that uh, to an orthodontist.
And
Well,
for the,
yeah, I know that. I'm just, if, I was just wondering if there was an in-house orthodontist that you have, or is it you refer that out?
we don't have an in-house orthodontist at this point.
Okay.
no.
We are looking into it. And once we get an in-house orthodontist, we can definitely run that by him or her.
Gotcha. And then if I do any cases, do I run that through my own my own account, or does that go through Clove account?
You should run it through the Clove account.
That's right.
The reason is
Yeah,
A,
I
the
get it.
lab fee is significantly lower,
Yeah.
and B, every patient who starts a case gets free whitening. So that's a good sales pitch for to do Invisalign, as
then
well as a good
you guys-
value add-on.
Do you have certain pricing set for certain cases and degrees of difficulties, or is it just a flat rate?
Yeah, basically we have the comprehensive, which is about 5,500,
Yeah.
and then we have the 6 month or less Invisalign Go for about 3,500.
Yeah, we're just doing aesthetic.
Yeah.
Also, the retainers are not included in that. You get 4 sets for $700, right?
Yep, correct. So
So the
that
retainers are extra.
the retainer, we do Vivera retainers. The 4 sets are extra, correct?
Okay.
But you can include the whitening in for the patient in the same fees. Is that correct, Anish? Ishan?
Yeah, you just give them whitening gel. I get it.
Okay. I mean, yeah, so I think it's an added value add to the patient.
Definitely.
And then with these new ClinCheck preferences, I think it should really help do the cases, much more efficiently and nicely in a shorter period of time.
Yeah.
So if you get a chance, just go through that in the portal, and it explains it very nicely. What else? Sleep apnea. Okay, so this is something which we want to inculcate in our practices. And how many of you are even discussing this with the patient?
All the time.
All
I
the
have it
time?
myself.
Yeah. So, a lot of times the sleep apnea does not get discussed or looked into. So I really want to make that a part of our examination. And there's a question in the medical history which really asks them if they have sleep difficulties, sleep apnea, or they have been diagnosed with this, or snoring. And if the patient says yes, then we can ask them further questions. Are they under CPAP therapy? Are they doing anything on it? And document that. And if the patient is not diagnosed, but they know that they snore or they have sleep problems or insomnia or some issue, then we have a setup. We have a service for the office, and we have some forms which the patient can fill out. And that includes basically patient sleep evaluation form, clinical questions in the form, and the patient fills it out, takes a few minutes, and we document that. And there are certain things we fill out from a clinical form, and I'll put all these forms in the Flex on the imaging side of it so that everybody has access to these forms. And they fill that out, and then we basically give these forms to the service, which is a sleep management service, and they will order a home sleep study for the patient, and they will get in touch with the patient, order the sleep study, and coordinate that with the patient, the sleep study. And they have a physician on their panel which will actually diagnose sleep apnea because a dentist cannot diagnose clinically a sleep apnea. It needs a physician to do that. So they will categorize the severity of the sleep apnea, whether it's severe, moderate, or early, and then follow through that with either a CPAP therapy or an oral appliance therapy. And that's where we come in, because there would be patients who are using CPAP, but they're not really satisfied with it. It's too, uncomfortable. They don't use it all the time. They would show interest in our oral sleep appliances. And then we would get that approved from their insurance. It is a process, but I think it's something we can help the patients with. And so I'm going to put all the clinical forms in the Flex on the imaging center. Anish, can that be done in the next week or so?
Yeah, I'll take care of it.
Okay, so then everybody gets to see it. If you have any questions regarding the protocol or the process, please reach out to me, and then I would do my best to answer those questions, because I think that would be a good service for our patients. Yeah. Any questions regarding this issue? All
I
right.
don't know the protocol for the sleep apnea, so if we can go over that like in a future care meeting,
Yeah, no,
that would,
definitely.
if somebody can present that, like, because I really have no idea what to talk about or how you even diagnose that.
Yeah, no, we would go over a little bit more detail. Hopefully next time we have more people joining us, so that that information gets distributed to everybody. But I will definitely be happy to go through with that in a little more detail, and we'll put the forms up so you can kind of access it and study them, and that kind of explains what we're looking for.
Yeah,
And
we'll go through it so that we know exactly what to look for and what to
Yeah,
discuss. Basically, you're just saying, how it works and why they need it.
yeah. So there's a Epworth sleepiness scale, and there are certain questions patient answers, and so I mean, this is all clinical protocol, and you have to document all that, because when you're getting it pre-approved, pre-authorized from the insurances, they see all that, they evaluate all that for the need of it, and the physician has to actually put a confirmed diagnosis in there. But from our point of view, I would put the protocol in there on the forms and kind of discuss it in the meeting also. Maybe next time when we come in, we have more people in there.
Sure.
All righty. So, and
I
the
had a
next,
quick point. I wanted everyone to be aware. I need everyone to start looking at their scans a little bit more. Whether they're using retraction cord or they're using Traxident or whatever they're using for retraction after a crown prep or inlay onlay prep. I'm getting responses that the scans aren't clear. So to me, that means either your assistant or you are not taking a good scan or reviewing it after, or your isolation isn't good enough. So it's pretty clear once you look at it after that whether it's a good scan or not. So just do me a favor, everyone, and just look at it just to confirm that it's what you see in your loops. And then if it's not, you have to retake the scan. A lot of times the tissue's covering the margin or whatnot. So you'll know whether or not to redo it.
so I get an email from the lab, Anish, if they have a question regarding a scan I have done.
So everyone gets those emails. The goal is to decrease the amount of emails. I had a call with the lab today. They were complaining that our doctors are not responding in a timely manner.
I
So
see.
I'd like to ideally cut it from the source. So do a better scan, decrease the amount of emails. And if you get the email, respond to it ASAP. Otherwise, the 2-week turnaround for the Crown is not,
Yeah,
not
they
a reality.
put the case on hold. Yes.
I have a question. Can you guys hear me?
Sure.
Yesterday I was doing I was redoing a veneer on this gentleman that he got his veneer done by Dr. Glassman, some really top cosmetic guy in Beverly Hills. And I felt a little weird because I wanted to get a picture for the lab. The lab just emailed me. I felt a little weird taking it with my phone. I'm not exactly sure how he got it last time. I didn't want to seem unprofessional. I took it with the iPad, which wasn't a great picture. I probably made a mistake doing that. I wanted to know how you guys would have wanted me to handle that next time. Take it with my phone?
Yeah, you can take it with your phone. I believe the Encino office has not a DSLR, but they have like a little pocket camera, point and shoot as well.
That's what I'll do next time.
iPhones really take good pictures in the portrait mode. If you really have the right lighting and all.
Yeah, iPhone is
are-
good.
No, generally
iPhones-
speaking, I would have done that just for this guy. I didn't know what he was used to. I didn't want to. But next time, yeah, I'll take it with my phone. Take it with my phone.
I usually just take it with my phone, and then you can also hold up the shade guide. If you're taking the photo for shade purposes, and then take a photo with the shade tab next to it, and it actually captures it pretty accurately, in my opinion.
Yeah. No, that is correct. So iPhones work really good. One of the workshops I took, this presenter was saying, and they went into details on the iPhones, different settings we have on the iPhone, which we never really look. They have a grid where you can actually center the photographs, and they have all these different tools in there built in, which you really helps you take a wonderful, nice, straight, good photograph in the portrait form, in the portrait area. So try using that. Moving on, inlays and onlays, basically, yeah, we went through that last time. Any restoration approaching 50% of the volume of the tooth, and indirect is mandated or required, really. Onlays if the cusp is undermined, inlays if the cusps are fine, but a larger contact point, buccolingually, I would do an inlay. In my hands, a composite inlay works really good. Emax can do it well, but composite really works, reinforced with the ceramic fibers, really works well, gets bonded onto the tooth. Onlays you can do either a Emax or even a zirconia. But yeah, try to diagnose those, and bonding protocol is is really important in that, for the longevity of that. Use isolite, different isolation. Anish, do we have all that in different offices?
We do in
Yeah.
most of the offices.
Even for composites, I would use an isolite. I mean, it really helps you retract and isolate good quality work in an efficient manner. So that's basically what I have. I'll get the floor open. Anybody with any comments or questions?
I have something I just want to. I mean, I spoke about this a little bit yesterday with I think he's Sean, and I meant to talk to Anish. So maybe if I just stick around at the end.
Yeah. Or you want to talk to them after the meeting?
Yeah,
Yes.
privately. Like if I just stick around.
Okay. All righty. Is Ishan